Now I'm trying to look at different types of surgeries that are actually done for the joint. Okay, it doesn't actually matter which joint. Okay, any joints in the body. So that's arthrodesis, arthroplasty, then arthroscopy. Okay, so there are actually types of joints that are joint surgeries. Okay, so discuss them one by one, and you guys will actually get to appreciate and also know them better. So the first one is arthrodesis. So arthrodesis, to me, understanding it just have to do it. They are trying to use what? They are trying to use some 1 or 2 ions inside just to keep a joint together or keep bones growing towards a particular place. Okay, or a particular side rather. Okay, so let's look at arthrodesis. So first of all, we have an introduction. So we said that generally knee joints can be treated surgically in different ways, right? So that's why the concept of arthrodesis, arthroplasty, and arthroscopy is coming in. So arthrodesis in the first place is what? The surgical fusion of a knee joint. Yeah, it's joints in general. Okay, actually, when I was developing the write-up, I did a mistake and I spoke about knee joint only. Like I was trying to develop the note on knee joint only, but any place you see knee joint is just the joint in general. Okay, you can see that it can be done anywhere. So it provides pain relief and all of that. Maybe there's arthritis, that's when you need to do it. Severe joint destruction, maybe arthritis. Okay, after a tumor resection, so require stability. You understand? So outcome is what? There's the patient walks with a stiff leg gait. All right, the leg is stiff, but they could still walk though. So that's it. Then for the next one is arthroplasty. This one is actually just reconstruction or replacement of the joint. Okay, it can be any joint, mustn't be. Can be any joint. Mustn't be knee joints. Okay, so we have the total knee one, we have the unicompartmental knee one, we have the patellofemoral one. Okay, it could be any joint, do you understand, in general. So indications, when there's advanced osteoarthritis, when there's rheumatoid arthritis, when there's a post-traumatic arthritis. So it just simply restores the mobility. There, reduces pain and improves the quality of life. The next, we're talking about arthroscopy. So arthroscopy is like a minimal surgery where they now do some small holes. So through those holes, they put something that is called the arthroscope. So when they put that arthroscope through those holes, they can now be able to operate on your joint, or they can be able to visualize the joint. So it can be used for both diagnostic and it can also be used for therapeutic. So that's what we got for that. So you can use for diagnosis and therapeutic, just like as I was saying. Okay. So indications, when there's meniscus tears, when there's ligament reconstruction, cartilage repairs, removal of loose bodies or synovial tissues and all of that. Okay, so it's actually minimal and it causes less harm to the patient.